Don't do what I did. When my first son asked me where babies came from, by the time I gave him my honest and open and clear, detailed gynecological explanation, he looked at me in shock and he said, "And you and Papa did this 3 times?" Welcome back to Gyno Info. Or if this is your first time, just welcome. I'm so glad you discovered us. In this podcast, we discuss common gynecological problems in a frank and open way that normal, everyday women can understand without a medical dictionary. This week, I'm going to answer a few of the questions that have been sent in by you, the listeners, to questions at gynoinfo.net that I thought you might find interesting as well. Here's the first question that I want to answer today. I'm a single woman in my late 30s, no relationship on the immediate horizon, but I know that I want kids for sure. Should I freeze my eggs? This question is about social freezing. Freezing eggs for future use for social reasons. That is the term used that you should be researching. This is opposed to medical freezing. Freezing eggs for future use for medical reasons. For instance, if a woman had cancer treatment that involved radiation and chemotherapy, which would destroy her or hamper her ovaries so she couldn't have eggs after that. And my answer to your question is absolutely, go for it. If you really want to have kids, do it rather sooner than later. It is a simple fact that a woman's fertility, her ability to get and then stay pregnant until the baby is born, becomes lower as she gets older. Late 30s is unfortunately already considered older. Even though some women will give birth until their late 40s, fertility begins to drop gradually beginning at age 30, then drops faster and faster after age 35 until by the early 40s, the rate is less than half of what it was at age 30. This is not only because there are fewer eggs as you get older, but the ones that you still have are less likely to turn into pregnancy when they meet up with a sperm. So you should make an appointment ASAP as soon as possible with a fertility center that offers social freezing. While you're waiting for the appointment, you could ask your own gynecologist to assess your so-called ovarian reserve, whether your ovaries are still producing eggs that are likely to be able to be fertilized. There are two ways to do this that should be done in combination. First, you can do an antral follicle count. That's count the number of ovarian follicles. Those are egg production units in the ovaries. To do this, you need a pelvic ultrasound, generally transvaginally done through the vagina. There should be a minimum of about 6 to 10 such follicles counted in both ovaries together, ready to start growing and producing the egg that will either ovulate or be harvested to freeze. But the average antral follicle count in a young woman is around 15 to 30. And then you can do a blood test to measure the anti-Müllerian hormone, a measure for the biological age of your ovaries, an AMH, anti-Müllerian hormone. If either follicle count or AMH are low, your chances of having a biological child are diminished. If they're super low, especially if you're already having begun to have shortened and irregular menstrual cycles, then your chances of getting pregnant are unfortunately pretty slim to non-existent. And you might be wasting your money trying to freeze old eggs that might not be able to result in a pregnancy. I generally start talking to my patients about social freezing by the time they're 32 at the very latest, earlier if they have a family history of early menopause. If, on the other hand, all the women on both sides of your family go through menopause way past 55 and have kids in their 40s, then you can have a little bit less of a worry. But the fact remains that younger frozen eggs are much more fertilizable, can be made pregnant, than eggs from a quote older woman. When I was in my medical training, I was always shocked when my colleagues talked about an elderly primigravida. That's a woman who hasn't had any children or is having her first child. They were talking about women my age, 30, 32. But unfortunately, as I have already mentioned, as far as fertility and obstetrics is concerned, late 30s already counts as older and early 30s maybe as elderly. But only stupid doctors ever say never. Nature has a way of making unexpected things happen. So I wish you the best of luck and very useful feeling ovaries, and hopefully you'll get your child someday. The next question has to do with osteoporosis, about which I've talked recently. Osteoporosis, bone loss or brittle bone disease leading to bones breaking. I recently did 2 podcast episodes on that. One on what osteoporosis is and how to prevent it, and the other episode on how to treat osteoporosis. But since the osteoporosis is a silent disease that happens in the background without you noticing it, and the first actual sign may already be a fracture, it is important to know whether you have it. The only way to know, unless your bones are already breaking, is to measure your bone density. This test is called a bone densitometry, or a DEXA for short. DEXA, and sometimes also just DXA. You lie with your clothes on a table, and a scanner moves over your body for a couple minutes, measuring your bone density. Results are then given for different bones in your body, but a minimum should be given for your hip bones, your wrists, and your lumbar spine, the bones that make up the backbone in the area of the small of your back. So here's the question the listener was asking. She said, I'm in my mid-50s and never had a bone density checked. After listening to your podcasts on osteoporosis, I got your point that it's extremely important to know whether I have osteoporosis so something can be done early on and on time. The problem is my doctor. When I asked him to order a DEXA exam, he asked if I had pain or broken any bones. And when I honestly answered and said no to both these questions, he said I did not need this test and refused to order it. So what do I do now? So that was her question. Well, the first part of the answer is that you are right and your doctor is badly informed, just dead wrong. He's not even really saving money by refusing to order this test. Preventable osteoporotic bone fractures cost in the US about $25 billion per year for just the direct costs of medical treatment of the fractures. The cost for lost income and disability and long-term care ends up costing society nearly 3 times that much, close to 75 billions per year. A bone density test, on the other hand, costs in the US, depending where you live, somewhere between 150 and 300 US dollars. In Switzerland, it's less than half that much. In medicine, prevention and early treatment of problems is much cheaper than waiting too long, and easier on the patient as well. It saves a lot of suffering. Just as recognizing and treating high blood pressure beats waiting for a heart attack or a stroke any day, recognizing weak bones before they break is smarter and cheaper medicine. And second, as to the doctor's questioning of you, osteoporosis does not hurt until you actually begin to break bones. The first sign is often a painful and expensive hip fracture or a wrist fracture when you try to catch yourself with a fall, or even a collapsed crash bone in your spine. Rib fractures from simply turning in your bed can also be osteoporotic fractures, but that's usually very late in the disease process. Late with severe osteoporosis, you can crack a rib simply by turning in your bed. But the point is to catch it much earlier. So the aches and pains in your arms and legs and your spine, is generally a symptom of osteoarthritis, inflammation of the joints, and it's not osteoporosis. As I said, osteoporosis only starts hurting when you start cracking. So asking you if you have been breaking bones recently is just misguided and wrong by your doctor. The whole point is to find out and do something before you start breaking bone. So my suggestion is to change doctor if that is an option open to you. Or you can ask one of your other doctors if you have more than one doctor in your life. And here's the most important point. You can guide your doctor's thinking and response by giving the right specific information. A lot of medicine has to do with pattern recognition. That means a doctor recognizes some symptoms and signs and risk factors that go into a package and then starts acting and thinking accordingly. So if you tell your doctor that you have gotten much shorter, have lost a couple of inches in height, a sign that some of your bones in your spine have collapsed, or that you feel you have a hard time standing up straight, a sign of a wedge-shaped fracture in your spine, or that all women in your family have severe osteoporosis and two of your grandparents have broken their hips, or that you used to smoke or still smoke heavily, or that you went through menopause really early on and never took any hormones, or that you are lactose intolerant, you don't tolerate milk products. All those things are risk factors for osteoporosis. So then chances are good that your doctor's brain will start flicking in the direction of osteoporosis, and he will be made much more likely to order your bone density test. If you have a health insurance, you can also try to call the insurance and give them the same clues, and they are highly likely to let you have a DEXA exam. I hope that gives you some ammunition. It does happen sometimes that patients ask for expensive and useless tests just because they have heard about them. But then the doctor should explain them to you carefully and tell you why ordering this particular test is not indicated and may even be harmful. But in this case, you are definitely right and the doctor is wrong. DEXA tests are never harmful and relatively inexpensive and give valuable information that should influence the quality of your life in the decades to come. Here's another option you might use if you need more ammunition to convince your doctor to order one of these DEXA tests. Type in FRAX, F-R-A-X, that stands for Fracture Risk Assessment Tool, in the search bar of a computer and start filling in the blanks. Then push Calculate. This tool will give you your personal fracture risk and give the recommendations of how to proceed. So please persist and ask for the care that you need and deserve. You deserve that care and you need it. Now here's another question. Is there any other way of getting chlamydia than sex? I was diagnosed with chlamydia, and my boyfriend swears he did not sleep with anyone else since we were together. Chlamydia is a very common sexually transmitted disease, and you do not get it from toilet seats, but only from sexual activity with someone who has it. Chlamydia bacteria cannot survive outside the body, so you cannot get infected with them other than through direct contact with another human body. That said, many people, especially men, but also women, may have no symptoms at all until they develop serious complications, and they are passing chlamydia on without knowing that they're doing so. So it is possible that your boyfriend may actually be telling the truth, and he had it without knowing it from someone else before he got together with you. If, however, you had negative, that means non-infected chlamydia test as part of a sexually transmitted disease screening anytime during your relationship, or you both had a negative STD screening before you stopped using condoms, which is something I recommend that all new couples do, then his story doesn't hold. And you need to decide what you want to do about this relationship. In my book, lying about stepping out is about 100 times worse and much harder to forgive than stepping out itself. So I'm so sorry if this is the situation you're in. This is very painful. There is time for one more question here. What age is appropriate to take my daughter for her first visit to a gynecologist? Another excellent question, but with no set answer. It all depends on where your daughter is in her journey of becoming a woman. Girls go through puberty, the change in a woman's body, leading up to the menarche, the first period, at greatly varying ages and pace. One 13-year-old may be boy crazy with raging hormones, while another one doesn't even have her period yet, is still waiting for her pre-puberty growth spurt, and continues to like to play with stuffed animals and finds all boys just stupid. My tip is to watch and talk to your daughter as openly as you can, but don't say more than she's ready to hear and is interested in. Don't do what I did. When my first son asked me where babies came from, by the time I gave him my honest and open and clear, detailed gynecological explanation, he looked at me in shock and he said, "And you and Papa did this 3 times?" We have 3 kids. So by the time the next to ask, I did a lot better. If your daughter has problems with her periods, if they're too much bleeding, too much cramps, or she has no periods at all by the age of 16, or if she shows a serious interest and curiosity about boys, or even if her girlfriends have been to see a gynecologist, offering her a visit to a female gynecologist that you yourself trust might be a good idea. Sell it to her as an opportunity to ask anything she wants to know, and reassure her that she will not have to agree to an exam the first time if she does not want to. This is a good way to teach her that she has control of her body and nobody can do anything to it that she does not want, that she is in charge of her body. That's the most important thing for a young girl to learn. There are also a number of excellent puberty information pieces on the homepages of different children's hospitals in the US that you might look at with your daughter together. Or you might listen to my podcast episode on the topic. I will soon produce one. One of the sites that I like a lot is Boston Children's Hospital. So this is all the time we have today. And I hope you liked this podcast. And if you liked it, please subscribe and give us many likes and comments because that helps other people to find this podcast in the future. And if you have questions yourself, please don't hesitate to send them to me to questions@gynoinfo.net, all in one word. Questions@gynoinfo.net. I will either answer them in one of the next question and answer episodes, or it might even be a whole episode by itself. Keep listening for it. Goodbye. Thank you for listening. Until next time, thank you for listening, and remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you and not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook at Gyno Info and on LinkedIn at Gyno Info Podcast. Remember, any questions that I answer or information that I give you on this podcast are to be understood as information only, not treatment of your medical problems. While I'm a very knowledgeable gynecologist, I'm not your gynecologist who has talked to you and examined you personally and is therefore actually able to treat you. So please consult your own healthcare professional with any medical questions or concerns.